Hi, and welcome to Words of Wisdom. My name is Yvonne, and I am the current president of Wisdom Chapter 25. And tonight, our show is going to be on Awareness Month information. If you want to locate us, you can locate us at Wisdom Chapter number 25. Our website is wisdomchapter25.org. We can be emailed at wisdomchapter25@hotmail.com or reached at 773-633-2640. Tonight, if you have any questions, comments, or referrals, information that you may want to chime in with, you can call us at the number below, 312-738-1060. So, in talking about awareness months, each month, as you may or may not know, there are different awareness things that come up, such as Lupus Society awareness, domestic violence awareness, and things of that such. But for the month of May, I've actually found a total of 32 awarenesses, and there may even be more. These were the ones that I was able to find in my research, and these includes ALS awareness, asthma awareness, arthritis awareness, allergy awareness, and things even such as Better Sleep Month. The things that we're going to talk about today are going to be asthma, and one of the other things that made the list for the month of May, which is lupus. So, on asthma, it's important to note that how asthma affects your lungs. Even if you've had asthma for a while, it can affect you differently as you get older. Asthma is a chronic condition, while there is no cure, you can still work with your doctor to manage it. Asthma occurs when there's inflammation of the airways, and it is an important component of asthma. Inflammation can make your airways more sensitive and more narrow than usual, making it harder for you to breathe. The airways in the lungs may react to various triggers and become more inflamed, as the muscle around the airways can also tighten. Some of the signs and symptoms of asthma include shortness of breath, coughing, wheezing, and even chest tightness. There are different kinds of trigger that can also cause asthma symptoms, and these can vary from person to person and may not always be identified as asthma. Some of the triggers include things such as allergens, as in dust mites, pollens, grass, weeds, mold, animal dander, or even cockroaches. It also includes irritants such as tobacco, chemical, sprays, cigarette smoke, respiratory illnesses such as a cold or flu, and even physical activities. But one of the less common things that people are aware of that can contribute to the onset of an asthma attack is something as simple as cold air. And stress. Stress can also trigger a life-threatening asthma attack. So, there are 6 different types of asthma. The first type we're going to talk about is allergic asthma. Allergic asthma occurs when an allergy sets off the asthma flare-up. Those allergies, again, can be contributed to mold, roaches, pollens, and pet dander. These are the most common allergies, but the list can be endless. Foods can also create a sensitivity that will cause you to have an asthma attack. And while most of the time we treat this type of asthma by finding out what the patient is allergic to so they know what they should avoid, sometimes that's not always detectable, such as in small children. Our second type of asthma is asthma that is not contributed to by allergies. People may also have asthma, usually an upper respiratory infection such as cold, flu, or rhinovirus that sets off their asthma. As soon as the cold symptoms first appear, patients are typically prescribed a short course of inhaled steroids for about 10 to 14 days. If you decrease inflammation in the body, you decrease your body's need to act out, which is what an asthma attack is, your body acting out. And when there's less inflammation around, there is less need for your bronchial to to constrict, causing you to be unable to breathe. So the third type of asthma that we're going to refer to is going to be aspirin exacerbated respiratory disease, or AERD. This is a type of asthma that is triggered by aspirin, regular aspirin, and patients who have nasal polyps, sneezing and or runny nose, and a history of aspirin sensitivity. What happens is when they take aspirin, they develop sneezing and a stuffy nose, which leads to wheezing and difficulty breathing. So if you have small children or even older adults that when they take aspirin, like some of us may take aspirin for arthritis or even as part of a heart regimen, if after they take the aspirin they're showing these signs and symptoms, it may be a good suggestion for you to have them tested to see if there is actually an allergy to the aspirin itself. The fourth type of asthma, and when I first read about this, I started laughing because it's called exercise-induced asthma. And the reason why I started laughing is because every time I try to exercise, I think I'm more of an excuse to not exercise more so than having asthma problems, although I am an asthma sufferer. I've never had this type of onset. But it's real and it's something serious. Because for these asthmatic, any type of physical exertion or sports that leads them to start coughing will trigger a severe asthma reaction. Meaning they'll begin to have chest tightening, shortness of breath, heart palpitations, and if they're not treated immediately and properly, it can lead to death. So if you're exercising and you're getting overexerted, sometimes just stop and take a break until your heart rates get back to normal, and you can go on. One thing about exercise-induced asthma is that there's a study that says taking 2,000 milligrams of vitamin C before you exercise can relieve exercise-induced asthma. Our next asthma type is going to be cough variant. Cough variant is an asthma that is characterized by a dry, hacking cough. It can occur while awake, asleep, and affect both children and adults. Patients usually respond well to inhaled steroids. Vitamin D has also been shown to improve this type of asthma. And studies show that there is less incidence of asthma from cough variant than any other type of asthma. It also shows that less incidence of asthma in southern regions, which may be related to people having less sun exposure and lower vitamin D levels in northern climates. And finally, our sixth type of asthma that we're going to discuss briefly is going to be occupational asthma. Occupational asthma occurs when something on the job sets off an asthma attack. It can be an irritant. It can be smoke inhaled from secondhand smoke. If you're working around chemicals, it can be a chemical reaction. And in occupations that deal with chemicals like paint or lab animals like rats or mice, patients may also be allergic to that as a trigger. So if you're working at a job and you're constantly going into active asthma attacks, it would be safe to find out exactly which of the triggers is setting off your asthma so that you can eliminate that from your daily routine. So that's on asthma. If you have any questions or concerns about any information that I just read to you, we will have information on our website tomorrow. And again, that's going to be wisdomchapter25 at hotmail.com. Our email and our website is wisdomchapter25.org. And again, we can be reached at 773-633-2640. The next thing that I want to talk to you all about is high blood pressure. And I'm not going to speak too much on high blood pressure. I do have a website that I want to show you all. And this is going to be a website. It's disabledworld.com, and it's their calculators. If you go on here, it will show you the different levels of where your blood pressure should be before it is considered high or low. On this slide, we see that blood pressure that is too low or hypotension is anything that is 90 over 60 is borderline low. If your blood pressure drops below 60 over 40, that's considered extremely low. And anything 50 over 33 is dangerously low. And any of these conditions under the 60 over 40, that person should be taken to the nearest emergency facility. Our normal blood pressure range should run 130 over 85. That's considered high normal, but it's not life-threatening. The perfect blood pressure in an adult person is going to be around 120 over 80. And 110 over 75 is normal low, which means that it's not where we want it to be at, but it's not life-threatening or serious. When we get into hypertension, that's that high blood pressure. That's when we're looking at numbers 210 over 140. Let me back up, because high blood pressure actually goes in stages, as you see by the slide. Stage 1 is 140 over 90. That means you're borderline high. 160 over 100, you're at stage 2. 180 over 110, you've reached stage 3. And when you get to 210 over 120, you most definitely should be at a facility that can help get your blood pressure down, because that is extremely high. And again, you all can go to this website anytime if you want to see what a normal blood pressure should look like for you. And this website will tell you by age. If you scroll down further, it will also tell you by, for your children, what their blood pressure should read like. Males and female children, because children's blood pressure actually run differently based on their gender. So that's just some information for you at disabledworld.com, calculator charts, if you want to look at that. So the next thing that we're going to talk about tonight is going to be lupus. Wisdom Chapter 25 is an organization that we like to help out in our communities in which we live and work in. And we have an initiative, One Sisterhood, Three Causes, with lupus being one of our very dear causes. So, again, May is Lupus Awareness Month, but tomorrow, May 10th, is actually World Lupus Day. For any of you all that have family or friends that may be living with lupus, there are a bunch of websites that you can go to find out where events are going to be held, find out information that you can use to assist your loved ones in everyday living if they have that condition. Some of the symptoms, well, lupus is actually known as systemic lupus, and I'm not going to butcher that word, but it's often abbreviated as SLE or lupus, and it's a chronic inflammatory disease as well, like asthma. And this disease occurs when your body's immune system attacks your own tissues and organs. There are many kinds of lupus. The most common type is the SLE, which affects many internal organs of the body. Mainly, it attacks the heart, joint, skin, lungs, blood vessels, liver, kidneys, and the nervous system. Children with this type of lupus generally present between the ages of 3 and 15, with girls outnumbering boys 4-1, meaning that our young women are more susceptible to developing lupus than our young men are. A typical sign or manifestation of lupus is a butterfly eruption on the face and photosensitivity. Lupus, which is again an autoimmune disease, again affects different parts of the body. A lot of the times, the person suffering from lupus has severe joint pain, such as elbow, knees, and hips. And in a person unaffected by lupus, the immune system produces proteins called antibodies in order to protect the body from bacteria, antigens, and viruses. But for a person who has lupus, the immune system cannot differentiate between antigens and the tissues of and the cells of the body. Their immune system creates antibodies that fight against it, called autoantibodies, and they cause pain, inflammation, and damage different parts of the body. The main feature of lupus inflammation is categorized by redness, heat, swelling, loss of function, and pain outside or inside the body, or both. Most people experience lupus as a mild disease that affects a few organs only, yet others who have lupus have serious life-threatening issues. There's data regarding lupus is somewhat limited, but studies on it suggest that there are more than 16,000 Americans who develop lupus every year. An estimate by the Lupus Foundation of America suggests that there are between 1.5 and 2 million Americans who are living with the form of lupus. The number may be higher in actuality, however. 90% or more of the people living with lupus are women, and of these women, the ones experiencing the symptoms and being diagnosed with it are of childbearing ages between 15 and 45. And in America, African Americans, Asian, Latinos, and Native Americans are more likely to have lupus than Caucasians. Lupus symptoms can mimic a number of other illnesses. That's one of the problems with this disease, is that it sometimes gets misdiagnosed because it mimics other things that we can have, such as arthritis. Because of the joint pain, sometimes the doctor will automatically assume that you have arthritis and not further test you. Sometimes the symptoms of lupus are vague, and this can make lupus hard to diagnose as well. Laboratory testing, review of the person's complete medical history, along with specialized testing concerning the person's immune status, can help to reach a decision of whether or not lupus is the correct diagnosis. In the medical field today, there is no one single laboratory test that can tell if a person has lupus or not. The American College of Rheumatology has issued a list of 11 symptoms or signs that can help to differentiate lupus from other disease. If a person has 4 or more of them, even if they do not occur at the same time, lupus is something that should be investigated further with the doctor. These 11 symptoms and signs are malar rash, a rash that appears over the cheeks. A discoid rash is a raised rash that appears in patches. Photosensitivity, a reaction to sunlight that results in the development of increased skin rashes. Oral ulcers, arthritis, renal disorder, neurological disorders, hematologic disorders that include leukopenia, where the white blood cell counts fall below 4,000 cells per cubic millimeter. Lymphopenia, and I hope I'm not misspelling these words or mispronouncing them, where there's less than 1,500 lymphocytes per cubic millimeter. I'm a college graduate, and some of these words are killing me. But the bottom line is that these are topics that are very important. And on our website, again, tomorrow, we will have information where you yourself or someone that you love is suffering from any of these disorders mentioned today. There will be information as to where you can go to find resources that can help you find a good doctor, other persons like yourself, and just a whole lot of information to help you deal with having to live with these illnesses. One thing that I did want to point out in closing, I have a few minutes left, is that May is also Military Appreciation Month. I want to first say thank you for all your service, your hard work, and dedications to all men and women who have and who are currently serving in our militaries. I know that is not an easy job, and you take it on with great pride, and we appreciate you at Wisdom Chapter 25. We have a caller. Caller, do you have a question or concern?
Hi, how are you?
Hi, I'm great. How are you?
Great. I just want to thank you so much for this information. It's really been helpful, and you're so nice to do this type of show, and I really, really appreciate it.
Well, I want to say thank you, and we appreciate you listening in.
Yeah.
So
I only caught a little bit of it, but the part about you're talking about blood pressure and all that is very good information. So thank you so much.
You're quite welcome, sir. And our website, I'm sorry.
Yeah, that's what I'm saying. How do we get a hold of you? Is there a website or anything?
Yes, sir. Our website is wisdomchapter25.org. And this information that I presented today will be uploaded to the website on tomorrow. It'll have the website that I used today that shows what your blood pressure should run between and what is considered dangerously high or low. It'll have all the information about also lupus, and any information that I presented today on blood pressure will be available on our website tomorrow. And I'm going to post our information again for our viewers. Our website is wisdomchapter25.org. Our email is wisdomchapter25@hotmail.com, where you can email us and someone will respond to you by email. And we can also be reached at 773-633-2640. Caller, do you have any other questions or concerns about this?
You are doing the work of the Lord, and thank you so much.
And thank you so much, sir, for calling in. I really appreciate that.
God bless you.
God bless you as well. Thank you for that, caller. Okay, so again, I found during my research a total of 32 awarenesses for this month. I'm sure there are others. Just to mention a few while I have just a couple minutes here. Again, like I said, it's Military Appreciation. It's Mobility Awareness Month. Motorcycle Awareness Month. It is actually Older Americans Month, so go give Grandma a hug and tell her thank you. It's Physical Fitness and Sports Month. It is also Stroke Awareness Month, Mental Health Month. Again, as I said, it's Lupus Awareness Month. And there are some great organizations that are working with lupus. There's the Lupus Society of Illinois. There are other great organizations that are helping with resources and treatments for lupus, as well as blood pressure, as we mentioned earlier, and some of the other elements that you will find on our website again tomorrow. So again, my name is Ivonne. This has been Words of Wisdom with Wisdom Chapter number 25. And I really do appreciate your tuning in. I appreciate our caller. And we'll be back here second Wednesday of every month at 5:30 p.m. Thank you so much for watching, and have a great evening.